If you think your morning coffee is only giving you a boost of energy to start your day, you are making a hidden mistake that affects your health. You are completely overlooking a silent chemical reaction that is quietly sabotaging your bladder and ruining your entire afternoon. For millions of men over the age of 50, that first cup of coffee is a sacred ritual that feels like the only way to truly wake up. But for a urologist, it is the primary suspect when a patient complains about a life that revolves entirely around the next restroom. We all love the mental clarity and the focus caffeine provides, but your aging body processes this stimulant differently than it did decades ago. Today, we are peeling back the curtain on the caffeine crash cycle to see why that 8 o'clock a.m. cup leads to a 2 o'clock p.m. physical emergency. We will explore the deep mechanics of bladder irritation, the science of diuretics, and why your afternoon fatigue is a direct result of morning habits. Before we begin, remember that this information is for educational purposes only to help you understand your body's unique and vital signals. If you are experiencing persistent urinary pain, blood, or significant changes in your habits, please consult with a healthcare professional or urologist immediately. Now let's look at the complex mechanics of what is actually happening inside your urinary system the moment you take that first sip, the detrusor muscle and the false alarm. To understand why coffee is a double-edged sword, we first have to look at what caffeine does to the delicate muscles surrounding your bladder. Most people think caffeine just wakes up the brain, but it is also a powerful chemical irritant to what we call the detrusor muscle. The detrusor is the smooth muscle responsible for contracting to push urine out of your body when your brain gives the signal that it's time. When caffeine enters your bloodstream, it reaches the bladder lining and begins to overstimulate these highly sensitive and reactive tissues. For a younger person, the bladder lining is thick, elastic, and resilient, but between the ages of 40 and 70, this lining undergoes significant changes. The lining becomes more sensitive, thinner, and much less elastic, meaning even a small amount of caffeine can trigger a massive false alarm. This chemical irritation tells your brain that your bladder is completely full, when in reality, it may actually only be a quarter of the way there. This is the reason you find yourself rushing to the bathroom 30 minutes after a cup, only to find that very little urine actually comes out. This repetitive false contraction wears out the muscle over time, making it weaker and more prone to spasms as the day goes on. By the time you reach lunch, your bladder muscle has already done a full day's work of unnecessary contracting, leaving it exhausted for the afternoon. The diuretic surge and kidney overdrive. The second major issue we must address is the diuretic effect, which is the process of your body flushing out water at an unnaturally accelerated rate. Caffeine works by inhibiting the antidiuretic hormone, or AD, which is the chemical signal that tells your kidneys to hold on to water for hydration. When this vital hormone is suppressed by your morning coffee, your kidneys receive a flood signal and begin dumping water into your bladder. This creates a massive volume spike in the early hours of the morning, stretching the bladder walls far beyond their comfortable resting limit. This stretching causes microscopic irritations in the bladder wall that don't just disappear once the coffee is gone. They last for several hours. By the time the afternoon rolls around, your bladder is already chronically inflamed and sensitized from the morning's heavy and sudden workload. This makes the bladder hypersensitive to any other fluid you drink later in the day, which is why we call this the ruined afternoon phenomenon. Your morning caffeine has sensitized your entire system so much that even a small glass of plain water at lunch sends you running for relief. You feel like you can't stay hydrated without immediately needing a restroom, creating a cycle of frustration that limits your freedom and your comfort. This constant state of emergency puts your nervous system on edge, making it difficult to relax or focus on your tasks during the day. The half-life and the prostate connection. Furthermore, we have to talk about the caffeine rebound effect and how it specifically impacts your prostate health and your overall energy levels. Caffeine has a biological half-life of about 5 to 6 hours, which is much longer than most people realize when they are finishing their mug. If you have a large, strong cup of coffee at 8 o'clock a.m., half of that stimulating caffeine is still circulating in your blood at 2 o'clock p.m. While the mental buzz in your brain might have faded into a fog, the irritating chemicals are still sitting in your bladder and kidneys. This leads to what we urologists call urgency incontinence, that sudden, uncontrollable urge to go that strikes while you are driving or in a meeting. For men who are already dealing with an enlarged prostate or BPH, this combination is a recipe for long-term physical disaster and daily discomfort. The prostate is already narrowing the exit path for urine, and when caffeine forces a forceful contraction, it creates dangerous levels of internal pressure. This high pressure can eventually lead to bladder wall thickening, which makes the bladder even less capable of holding urine in the future. This means the damage isn't just for today. The repetitive pressure from daily caffeine can permanently change how your bladder functions as you age. It's a cumulative effect that slowly reduces the time you can spend away from a bathroom, effectively shrinking your world and your independence, acidity, and the chemical burn. Another hidden factor that many seniors overlook is the high acidity of coffee, which goes far beyond just the caffeine molecules themselves. Coffee is one of the most acidic beverages we consume, and this acid acts as a secondary irritant to urological tissues that have thinned over time. Even if you switch to decaf, the acidic compounds often remain, continuing to irritate the bladder lining throughout the morning and afternoon hours. When this concentrated acid sits in your bladder for hours, it creates a burning sensation or a constant nagging feeling of heaviness and pressure. Many men mistake this uncomfortable feeling for a low-grade urinary tract infection, when it is actually just a chemical reaction to their morning brew. By the time your afternoon officially starts, your internal chemistry is completely out of balance and your kidneys are struggling to find stability. This creates a cycle of physical fatigue where you feel the need for more coffee to wake up, which only worsens the underlying bladder inflammation. It becomes a painful downward spiral that steals your independence, ruins your focus, and makes the best hours of your day feel like a chore. Now that we understand how the morning cup causes the afternoon crash, the question is, do you have to give up coffee forever? The good news is that for most men over 50, you don't need total abstinence. You need a smarter, more strategic approach. The water first rule, the first and most powerful change you can make, is what urologists call the buffer method or the water first rule. Most people reach for coffee the second they wake up, when their body is already at its most dehydrated state from a night of sleep. By pouring acidic caffeine into a dehydrated system, you are essentially burning the bladder lining before it has any protection. Starting your day with 12 to 16 ounces of room temperature water creates a protective dilution layer in your kidneys and bladder. This simple habit dilutes the concentration of caffeine and acid that will follow, significantly reducing the irritation to the detrusor muscle. It allows your kidneys to start filtering safely before the diuretic spike hits, preventing that sudden 10 o'clock a.m. emergency rush. The golden window timing is everything. Timing is your second most important tool in reclaiming your afternoon from the constant need to find a restroom. Urologists recommend waiting at least 60 to 90 minutes after waking up before taking your first sip of caffeine. During the first hour of the day, your natural cortisol levels are rising to wake you up, and adding coffee too early spikes these levels unnaturally. By waiting until 9:30 or 10 o'clock a.m., you align the caffeine boost with your body's natural energy dip, making it more effective. More importantly, this delays the caffeine half-life so that the peak irritation doesn't hit right when you are trying to be productive in the afternoon. It gives your bladder a chance to wake up and function normally before the chemical stimulants begin to force those aggressive contractions. The low-acid alternative, if you find that your bladder is particularly sensitive, the type of bean and the brewing method you choose can make a massive difference. Dark roast coffees are actually less acidic than light roasts because the longer roasting process breaks down the chemicals that irritate the bladder. Even better, switching to cold brew coffee can reduce the acid content by over 60% compared to traditional hot brewed coffee. Cold brew extraction leaves behind many of the bitter oils and acids that act as primary triggers for urinary urgency and frequency. For the senior demographic, switching to a low-acid dark roast can feel like a miracle for their bladder comfort without sacrificing the morning ritual. It allows you to enjoy the flavor and the focus while keeping the internal environment of your urinary tract much more stable. The counter-hydration strategy, a common mistake men make, is stopping all water intake in the afternoon because they are tired of running to the bathroom so often. However, this actually makes the problem worse because concentrated, dark urine is even more irritating to a sensitive bladder lining. The counter-hydration strategy means drinking 1 glass of water for every cup of coffee, but sipping it slowly throughout the hour. This keeps the urine diluted enough that the caffeine and acids don't sting the bladder walls as they sit in the reservoir. By maintaining a steady, slow flow of hydration, you prevent the bladder from going into a spasm caused by highly concentrated waste. This is the secret to staying hydrated while also staying in control of your schedule and your physical comfort. The bladder training technique. We must also discuss bladder training, which is a way to retrain your brain and muscles to ignore those false caffeine-induced alarms. When you feel that sudden caffeine-driven urge to go just 20 minutes after drinking, try to wait for just 5 extra minutes. Over time, you can increase this wait to 10 or 15 minutes, teaching your detrusor muscle to stay relaxed even when caffeine is present. This prevents the shrunken bladder syndrome where the bladder becomes used to only holding small amounts of liquid before demanding release. For men over 60, this mental and physical training is essential for maintaining long-term independence and confidence in public spaces. It breaks the psychological link between the sip of coffee and the need to pee, putting the control back in your hands. The prostate buffer: if you are dealing with BPH or an enlarged prostate, consider adding a high-quality pumpkin seed oil or saw palmetto supplement to your routine. While these don't stop the caffeine effect, they help support the overall health of the prostate, reducing the resistance the bladder has to fight against. A healthier, more relaxed prostate means that even if the bladder does contract, the urine can exit more easily and with less internal pressure. This prevents the long-term thickening of the bladder wall that we discussed in the first part of this video. Conclusion: and reclaiming the afternoon, your morning coffee doesn't have to be your enemy, but it does require a new level of respect as your body enters its senior years. By implementing the water-first rule, choosing low-acid roasts, and practicing bladder training, you can enjoy your brew and your afternoon. You deserve to have the energy to enjoy your day without being tethered to a bathroom map or living in constant physical discomfort. Start by making just one of these changes tomorrow morning, and pay close attention to how your body feels at 3 p.m. You will likely find that your energy is more stable, your bladder is calmer, and your independence is fully restored. Thank you for watching, and remember that taking care of your urological health is one of the best investments you can make in your longevity. Stay informed, stay proactive, and we will see you in the next video for more expert advice on navigating your health after 50.